Bruxism causing facial pain is one of the most common yet misunderstood condition. Patients often blame their teeth, but the real problem is usually muscle overactivity from clenching and grinding. This leads to muscle fatigue, trigger points, jaw stiffness, and morning soreness. And what drives this? Stress. It increases muscle tension, causes unconscious daytime clenching, and amplifies pain perception. Now here's the key. Occlusion is not the primary cause. Bruxism is mostly centrally mediated, not tooth driving. So, occlusion correction alone will rarely solve the issue. Clinically, you will see dull, aching pain, muscle tenderness, and sometimes tooth wear. Diagnosis is mainly clinical, taking proper history, doing palpation, and knowing the habit. And the management focuses on reducing muscle load, awareness of habit, stress control, splints, and physiotherapy. So, if there is facial pain, clenching, and stress, think bruxism-related myofascial pain. Because sometimes it's not the teeth, it's the muscle telling the story.